Child Health and Wellbeing Network Huddle on nature and health. Next slide, please. Fabulous. So please feel free to engage with the session and share throughout your social media platforms. There's a link here on this slide to our website for more information about us and our programmes of work, and a link here for you to sign up to our network so you can share widely amongst colleagues and peers. Next slide, please. So in terms of who we are in the room, we're delighted to welcome a large group of professionals and individuals from across our system and across our North East North Cumbria geography. It's great to see so many partners, including those from local authorities, schools, voluntary community sectors, as well as other health system and interested parties. Next slide, please. By way of introduction then, my name's Louise Dauncey and I'm Network Delivery Manager for the Child Health and Wellbeing Network. My main role and responsibility is for delivery of the Children and Young Persons Transformation Programme here in the North East and North Cumbria. I hope to open the session with a brief introduction to the Child Health and Wellbeing Network and to set the scene in relation to our diverse portfolio and programmes of work. Next slide, please. I won't labour on this slide, but wanted to highlight the local levels of relative poverty and our challenges here in the North East and North Cumbria. As a professional at living and/or working in this area, I'm sure that you'll be well aware of the socioeconomic challenges locally and the impact of this on health and other outcomes for our children and young persons population. Highlighted here are the highest rates of poverty in the North East and North Cumbria, and it is significant that 27% of children in the North East live in relative poverty in comparison to other areas of the country, national average of 20%. This slide also describes some of the suggested ways that we are seeking to overcome these challenges, including collaborative work across the system, developing strong mutually beneficial relationships, and targeting resource and upskilling our frontline workforce. Next slide, please. So I just wanted to share an outline of the evolution of our network and the development since its inception as far back as 2018. There have been many changes and developments in relation to the funding sources and work programmes. You will appreciate that over this time, we have secured funding from different streams to support the development of the children's agenda from a broad range of sources, including monies from NHS England Baseline, Charities Together, which is obviously Charity Commission, and also NHS England Children and Young Persons Transformation Programme and Integration Centre funding. We've also sourced other partnership funding opportunities, for example, the Arts Council, and most recently we've been able to draw down some financial resource from the North East North Cumbria ICB Healthier and Fairer programme. And until 2024 April, we had been hosted by NHS England, and now we've been brought into the ICB to deliver the children's programme. And our interface and arrangements with the local delivery teams are evolving. Next slide, please. So the Child Health and Wellbeing Network has a series of priorities that have been determined by initial consultation. This was validated in 2021 and an additional priority relating to family support was identified. Again, these areas here in that colourful wheel will not be a surprise to colleagues, given what we know about the local levels of deprivation in our area. The Child Health and Wellbeing Network has an overriding vision which holds children, young people and their families at the centre of all we do, and the mission statement here on the left-hand side outlines the belief that children should be given opportunities to flourish and that we can do that by enabling system-wide organisations to work cohesively. And our role as a network is about sharing good practice and driving improvement and enabling platforms for connection, such as this Huddle. Our network is growing and has broad representation from across the children's workforce, and we currently stand at over 2,000 members. Next slide, please. So information on this slide is taken from a range of sources, including Fingertips child health profiles. You'll see here we've got A&E attendance data from the North of England Commissioning Support Service. We've got data around poverty from the Time for Action report. Information here about asthma deaths from Asthma and Lung UK. And we've got figures here regarding diabetes type 2 from the Nutrition Campaign report. So you can see some fairly shocking stats from Amanda Bailey, which was part of the North East Poverty Commission report, which was shared in our recent exec meeting. 1 in 5 children in our region live below the deep poverty line, and this includes more than 1 in 10 of all children living in very deep poverty. This is a real challenge for us, and obviously there's a figure there that describes children who are living in food insecure environments. So 1 in 5, which is quite significant, and that just encapsulates the challenge that we've got around deprivation in our area. Next slide, please. I won't go into detail on this slide, but this just provides some local context and children and young persons population data, and also gives an indication of the size of our huge geography. The map on the right shows the 4 area ICPs, Integrated Care Partnerships, and the North East North Cumbria Integrated Care System marks out the 13 local authority education areas, 13 local authorities, 13 public health authorities, 8 acute trusts, 2 mental health trusts, and 3 ambulance trusts, as well as numerous primary care networks. You'll also appreciate that the education system forms a valuable part of our ICS, and within this, consider the 1,400 schools and education settings across our massive geography. We operate across a wide geography with diverse population and subsequent wide-ranging socioeconomic challenges. Next slide, please. So in relation to the levels of poverty and subsequent challenges associated with deprivation, in 2021, the Child Health and Wellbeing Network commissioned the production of a Facts of Life document, which brings together a range of publicly available information to highlight our local challenges. The report is helpfully broken up into chapters, which are available widely to support the development of programmes and to support with targeting resource. There is a link on the slide for you to be able to access the report at your leisure. Next slide, please. So you can see here an outline of the various strands of work for the Child Health and Wellbeing Network. Children and Young Persons Transformation is a core programme for our work in the network, and we have a range of advisors to support us across our system. Youth Voice is an integral part of our role, and as such, all of our activity is focused around young people and their families. So this work includes a group of young advisors, a young executive who are influential in our governance processes, and also an ongoing programme of communication and engagement, providing an offer of communication and training opportunities, as well as our weekly newsletter. Next slide, please. So during the initial setup of the Child Health and Wellbeing Network as far back as 2018, we worked really closely with a group of young people and produced a working together strategy. One of the outcomes of this report was that our young advisor group was set up to respond to young people's feedback, which gave them an opportunity to have a say in our work and represent their peers as part of the region. The cross-system nature of our work enables us to promote the voice of the child and the young person from across the system. And our young advisors have worked with Dr. Rawls, who is a lecturer in education from Newcastle University, to create a manifesto about how they would want to work with us as our executive board. So from this project, our young advisor group has evolved to the Young Persons Know Our Impact group, and this is now being facilitated by Investors in Children until March 2025. So the group meet prior to the adult board and receive papers and agendas and discuss their views on the proposals, papers and various activities within the network. These are just some of the examples of how we're responding to their manifesto asks. There's a link on this slide to a great video which has been recorded by one of the young people explaining the manifesto and the youth board theory of change artwork, which is the image on the top right of that slide. Next slide, please. So that's it for me. I'll just leave you with a quote from Sir Al Ainsley Green, which is the essence of our work and our moral responsibilities to advocate for children and young people, and this work and use our work to promote the advancement of their interests. So that's it from me. I'll hand now to Dr. Mike McKean, who's the chair for today's session. Over to you, Mike. Thank you very much.
And thank you, Louise, for, hopefully you can hear me all, thank you for sharing the story so far in terms of coordination and networking for children's health and well-being, and quite a lot's been done, and unfortunately there's still a lot to do. So apologies first for me. I'm in a ward. I've been called urgently to see a patient, and I'm halfway through assessing them and need to sort out some problems with sorting this patient out. So I'll be dipping out in a moment to finish that. So I'm a respiratory paediatrician based at the Great North Children's Hospital, and it's been my pleasure to be involved in the network for a number of years now, since it started really. And one of the roles for doing this was to start to think about how do we interact with professionals working and interested in working with children across multiple sectors. So it's not just all about paediatricians or GPs, but what about our therapists? What about our social care workers? What about education and teachers? And also the voluntary sector, if you like. And that led us to start thinking a while ago about wider aspects of well-being of children. And we all probably know, and it's not rocket science, isn't it, to say that there's something about nature that gives us a step in our stride and can bring a smile or calmness or time to connect with our wonderful world and give a perspective as well. And I think all of us here will probably know that, and we feel it just to a greater or lesser extent. But what we've never really been good at is thinking about nature as being healing and being part of everybody's day-to-day experience. And certainly in a hospital environment, those of you who've worked in hospitals, and I'm sure all of you who have not worked there will have visited them, they're not always a place where you see lots of nature. Some buildings and some places are surrounded by nature, but many aren't. And certainly the big hospital I work in has fairly little aspects of nature within it. There is attempts to put it around it, but it's still a challenge, I think. So when we're thinking about children's well-being, it's easy to think, well, we've got to get the medicines right, we've got to get the care right. But there's something about the environment within which we all live and our children and young people grow up. As we see, so many of them are living in poverty. So many that end up with significant chronic illnesses have a double whammy of living in a poor environment as well as having a significant chronic illness. And we don't always put a mind to the environment they're living in and how important that is. So it's with absolute great pleasure that I'm going to introduce two people who've been thinking about this a lot more deeply than I ever have. I'm sad I'm going to miss a bit of their talks, but I know the sort of work they've been doing, and Amelia's going to keep an eye on the chairing and the chat, but I hope to rejoin you before the end. I hope they're going to stimulate us to all think a bit about how we bring nature into our work and not see it as an add-on, but actually perhaps I would challenge us to start thinking as a core thing that we're doing. So Emma, I'll let you introduce yourselves because I think that would be far better, but I've known Emma for some time as a paediatric trainee, then a genetics trainee, and now developing a solid interest and a very strong interest in sustainable healthcare. And of course that links into thinking about well-being quite significantly. So it'd be great to hear what Emma's been up to. And then Liz, well, you're going to tell us all a bit about Northumberland Wildlife Trust, but also the importance of nature in terms of people's well-being, and obviously we're interested in children and young people as well. So I'm going to hand over to them, and I wish you well, and I'll sort out the little problems we have here and join you again in a few minutes, I hope. Take care.
Thank you. I'm going to share my screen for our presentation. There we go. Okay, hopefully everyone can see that now. So yeah, as Mike has said, our presentation is all about nature, health, and young people, and how the links that bring all of those together. We're going to give you a lot of background to the climate crisis and how that impacts young people's health, and then lots of examples of work that we are doing at Northumberland Wildlife Trust to bring well-being and nature together, and a partnership that we formed with the NHS. So yeah, I'm Liz Heard, the Wild City Manager at Northumberland Wildlife Trust. So I manage a lovely team of people all focused on connecting people with nature and helping people to take action for nature. And then we've also got Emma with us, who can introduce herself.
Yeah, hi everyone, thanks for having us. I'm Emma Vittery. I'm a Paediatric Sustainability Fellow at the Great North Children's Hospital as part of Newcastle upon Tyne's Hospitals Trust, and that post is also jointly supervised by the Centre for Sustainable Healthcare. And we've also got Gracie, one of our young people at the Great North Children's Hospital, and she's become an eco-influencer as part of this partnership. So she's going to help us give this presentation through a few videos that she's recorded.
So yeah, a bit of an outline. We're going to start off with climate change and how that is impacting young people. We're going to talk about our connection with nature and how that benefits our health. We'll run through a few examples, and then we'll look at inside a hospital context and how all of that links in there. And then we'll have time at the end for discussion and sharing. And I know there's a lot of you that are on the call today that are already doing a lot of work around nature and health and supporting young people to connect with nature. So it'd be great to hear from you and to share any opportunities or projects that people can get involved in or be inspired by. So for those of you that don't know, Northumberland Wildlife Trust is one of 46 wildlife trusts across the country. We're a charity dedicated to protecting and restoring nature across our region. So that's Newcastle, Northumberland and North Tyneside. Within that, we've got 72 nature reserves, some of which we own ourselves, others of which we manage on behalf of others. And I've recently learned that that's more than the number of Gregs in our region, so that's a great win. And the focus of the team that I manage is connecting people, especially those facing barriers to accessing nature, to both connect with nature, but then gain the skills, confidence and networks so they can act and make change in their local communities. So in the past year, we worked with just under 10,000 people and supported just over 50 youth and community projects in the community led by the community.
Thanks, Liz. So just a quick background about the Great North Children's Hospital. So we're one of the major children's centres in the UK, and we've got one of the most extensive ranges of children's services outside of London. Children, young people and families come from across the northeast and Cumbria, but they also travel from across the country to access a number of our specialist services. And we're in our second year now of having a hospital charity-funded paediatric sustainability fellow, which is the role that I've been doing this work in. So next slide, please. So I think I mentioned the fellowship's jointly supervised by the Centre for Sustainable Healthcare. So this is an independent non-profit organisation just trying to integrate sustainability into healthcare. They do amazing work. They've got a massive case study of sustainable quality improvement projects. They run a number of different training programs on sustainable healthcare, including a paediatric specific one and carbon footprinting. There's a number of networks, including a paediatric sustainability network, and they also run the NHS forest programme. We're just going to play you a quick video now of Gracie, who's going to introduce herself and share something about what she likes doing in her free time.
Hi, I'm Gracie, I'm 13, and one thing I like doing in my spare time is aerial. Aerial is basically gymnastics in the air with things suspended from the ceiling, like hoops and things that you climb
on. Just a bit of context setting. I'm not going to tell you all about the scary stats around climate change globally. You're probably all aware of that. And yeah, we don't want to stress people out. But I think what's important to note is the local climate change impacts. Lots of people think about the impacts that are happening right now, sort of being around the equator. But actually we are seeing impacts here at home, which is why it is important to act. So you might be noticing we're seeing increased frequency and severity of storms. So here's a picture post-storm Arwen a few years ago. We're seeing our coastlines being at risk of sea level rise. So this is one of our nature reserves near Amble called Hawksley Nature Reserve. And over the years, we've noticed the distance between the nature reserve and the sea decreasing. And we're also seeing sort of drier summers, so lots of ponds drying up like this, but also increased risk of wildfires. So last year we actually had a fire at one of our sites near the airport because of the sort of extreme heat and dryness of that season.
Thanks, Liz. Yeah, so we know that this translates into climate impacts for children and young people and infants. So worldwide, over 99% of children are already exposed to one or more of these sorts of environmental risks to their health. And there's a few examples shown there on the slide. One of the things we really wanted to highlight is that infants, children and young people are particularly vulnerable to the effects of climate change and will also be exposed to and have to live with the consequences of this for longer. So, for example, infants and children crawling close to the ground, they put their hands to their mouth a lot, they breathe faster, so they might take in more pollutants. And there's a few other examples on there. So next slide, please. And the other key point is that climate change is inextricably linked to wider issues of inequality and failures to uphold children's basic rights to, clean environments, essentially. And we know that, unfortunately, the impacts of these will be compounded, for certain children and young people living, for example, through conflict, in less economically secure families, etc., as was mentioned at the start of this, the intro to this talk. Liz is going to send out with our slides a link to an original poem by a young person from the Royal College of Paediatric Child Health and Us about climate change, which I think is really powerful. So I'd really encourage you all to have a listen to that also. Thanks, Liz.
Okay, so one of the impacts that climate change is causing across all ages, but mostly in young people, is eco-distress. You might have heard eco-anxiety, climate anxiety before. And essentially, it's those feelings as a response to the climate crisis. That could be sadness, grief, anxiety, panic, guilt, powerlessness, and anger. And you all might have felt something like this too before. So a recent study from The Lancet of 10,000 young people across 10 different countries, including the UK, found that 75% of young people surveyed thought the future was frightening, 56% felt that humanity were doomed, 4 out of 10 thought that they might not have children because of the fear of what the future might look like for them, and nearly half reporting an impact on their daily functioning because of those feelings as well. And what was interesting was the children in countries that are already experiencing more climate change impacts, so places like India, Brazil, and Philippines, that were surveyed, were more likely to be extremely worried. And then places like the UK that are having slightly less extreme impacts of climate change impacting their daily lives felt slightly less worried than children in those other places. And what's come out of this is that young people are feeling really let down by the people in power. And there are lots of feelings of betrayal, anguish, and abandonment towards governments in particular, and feeling like they're failing to act. It's important to note that eco-distress is not a mental health condition, but it could lead to further conditions, as it is a long-term chronic stressor that's quite inescapable as well. But what can we do to help that? So we're going to share a few examples later on of projects where we've sort of harnessed this into something good. But essentially, having one's feelings heard, validated, respected, and acted upon, and then accompanying that with pro-environmental actions is what sees that eco-distress sort of lowering down and more hope coming out instead. Oh, I should say here, so we're going to hear a video now from Lucy, who's one of the members of our Young People's Forum. She has experienced eco-distress herself, and she's also in and out of hospital herself too. But she's going to share a little bit about why she thinks it is so important that we really involve young people in climate action. So I'll let Lucy tell you that herself.
I believe it's important for young people to be involved in environmental action because they are the future. Unfortunately, previous generations have contributed to the climate crisis, and it has left the burden on the shoulders of young people today. And while it shouldn't be their responsibility alone, I believe they should have a say in climate action and be involved, as it directly affects all of us.
Thanks, Liz. So again, we probably all know that there's an absolute wealth of evidence out there about the benefits of being in nature. So we're just going to touch on a couple here, and we'll come back to them throughout the project. But we know that being in green spaces for children and young people can aid their development and education. So, for example, can show there's evidence to show improved neurocognition, school attendance and achievement, and social skills such as teamwork. And Liz is going to talk a little bit more about nature in relation to education a little bit later on. There's also evidence that there's actually lower risk of autism and risk of ADHD and severity of symptoms for those with neurodiversity in terms of being in green spaces. And then I think perhaps sometimes more widely known about other physical health benefits. So this includes things like increased improved birth outcomes, so things like lower chance of lower birth weight or small for gestational age, lower body mass index and obesity risks, and higher bone density linked to physical activity in green spaces, and also improved lung function and lower risk of certain immune conditions like asthma and even acute leukemia. And the other thing just to stress is that the mental health and emotional well-being benefits, we know those are more likely to be felt for those already experiencing health inequalities. And as I think Mike's mentioned, you know, we've all been out in green spaces or blue spaces and felt that release and felt that benefit, but it's often hard to quantify those benefits and therefore sort of use that to drive change. But there are a number of meta-analyses. There's a recent one in the Lancet from China about showing that even though a number of these papers perhaps deem sort of lower quality in terms of traditional ways of looking at evidence base, you know, looking at them together does show the wealth of evidence there to confirm these associations. And the Northumberland Wildlife Trust recently produced a report on the cost-benefit implications of targeted nature-based health and wellbeing programs. And this showed that this has the potential to save £365.6 million each year. So although that's just one report, it's based, I think, largely on 6 projects nationally that focus on adults. It's still such a monumental paper for sort of leading the way on showing the cost-benefit implications of these approaches in health services. Thanks, Liz.
Perfect. Yeah, and so that report was commissioned by the Wildlife Trust, not just us here in Northumberland, in partnership with the consultancy, and I think one of the integrated care boards as well. So yeah, we all know the benefits of nature, but how do we actually measure that and understand how different people are experiencing those benefits? So that's something that the University of Derby did with a big group of professionals, and they developed something called the Nature Connectedness Index, which is a really good way of being able to measure a person's relationship with the natural world. So they came up with a really simple 6-scale item, and I've listed the questions here on the slide. And essentially, people rate themselves from strongly disagree to strongly agree on how they agree with those statements. And together that comes up with a score out of 100, so with 100 being, you know, extremely connected to nature. Here. So we've been using that at Northumberland Wildlife Trust, and I don't know if any of you else on the call have been as well. When we're working long term with people, it's a really good way for us to see the impact of our work and is what we're doing actually connecting people with nature better. Now, because we have got these measurable scores, lots of people have done research around how people are connected to nature and what things impact that. And what we are seeing is people, as you might imagine, becoming more disconnected with nature and certain things that relate to that. So across Europe, unfortunately, Britain ranks bottom for nature connectedness. And another interesting trend is seeing nature connectedness dip in teenage years. So from about age 11, we start to see a decline in how people feel connected to nature, and we don't gain back up to those same levels as early childhood until about age 30 and above. And interestingly, that timing of slowly dipping in teenage years correlates with the highest onset of many mental health conditions in young people. So they're sort of losing that benefit of nature to help, which could help them against that as well. You're probably asking, why does it dip in teenage years? There's lots of different possible reasons. And essentially, people have linked it to the sort of the major developmental changes that are happening in young people at that stage of their lives, sort of a transition between schools, lots of development of self-identity, emotional regulation, that sort of thing. And that because during this time of change, there's lots more things that are becoming relevant and important to them, and nature can drop off the agenda a little bit there. So nature connectedness, higher scores are linked to higher well-being, but also pro-environmental behaviours. So that's actively taking action for nature and living a more sustainable lifestyle. And research from the University of Derby have shown that you would need a mean score of above 70 in nature connectedness as a minimum to help deliver a sustainable future across our populations. And that's 15% above the current average of 61. So yeah, it's really important for us to help people to connect with nature in order for both those well-being boosts, but also so that we can start to see the change that we need in order to tackle the climate crisis. And yeah, here's a few more graphs here about that. I won't go into it, but we'll send the slides afterwards so you can look a little bit about that if you are interested.
Thanks, Liz. And again, we know that those facing social disadvantage can benefit more from interacting with nature. But I mean, nationally, only about 38% of people live within 15 minutes of a green space. And we know that families with lower income facing higher deprivation are less likely to visit natural spaces. So, for example, in the UK, 44% of people living in poverty visit green spaces regularly versus 70% in households with higher earnings. And accessibility and cost are most often cited as the main barriers to accessing nature. But we also need to remember there's things like facilities and also safety that play in. And these same factors contribute to the wider determinants of health and health inequalities. And a number of you are probably familiar with this diagram about the determinants of health and well-being. And I just wanted to remind you that the natural environment plays a real umbrella role in the determinants of health and well-being, and we need to remember that. Thanks, Liz.
Great. Okay. So that's sort of a bit of the background to set the scene for you and hopefully highlight the importance of health and nature connectedness as well. And I know lots of you on the call are doing lots of things already that bring young people closer to nature. And I'm really excited to hear about them. But we're just going to share a few projects that we're working with at Northumberland Wildlife Trust to show how we're trying to bring people closer to nature for their health and how we've gone about doing those. So we're going to start off with our education and learning. Outdoor learning and bringing nature into the curriculum is shown to have loads of benefits, from boosting well-being to increasing educational attainment and aspirations, improving behaviour inside lessons, and also building those skills for life as well. So at Northumberland Wildlife Trust, our education team works with school-age children, really focusing on connecting them to the natural world and trying to integrate outdoor learning and nature into day-to-day school life. So sort of in the past, we tended to do one-off sessions with groups on our nature reserves or going into schools to do sessions. And although that provided amazing experiences for young people, we weren't necessarily seeing those long-term impacts. So what we're now focusing on is building long-term quality partnerships with schools where we can help them to build up the skills and the resources so that their staff and also students are able to do this themselves in the future. So some examples of that is delivering educator training to support teachers to feel confident to deliver things outside, because for them that's a big change and it increases risks and lots of other factors and sort of a feeling of lack of control that a few of them have told us about. But also top tips on how to integrate nature into lessons, sort of based on their curriculum, how they could do that outdoors or how they could use nature-based examples inside as well. And we've also worked with a lot of schools to help improve their school grounds, both for wildlife, but also to improve use by the young people of those school grounds as well, sort of with a well-being angle, but then also sort of an extracurricular clubs angle as well. So one example here is a school we've worked with that's really near our offices in Gosforth in Newcastle, Gosforth Junior High Academy. So we first started working with this school to deliver forest school style sessions to a select group of pupils that the school selected based on them feeling like they didn't have as many opportunities to access nature as some of the other pupils. And that had amazing feedback from both the young people and the teachers, who noticed changes in terms of confidence, behaviour, both in the classroom and when they were out on these sessions as well. So they asked us, can we do more? How can we integrate this more into school life? So we supported them to set up a youth-led gardening group, and they took over ownership of a section of the school grounds. And we supported them with fundraising to get some equipment and plants to get things going, as well as facilitating some sessions with the teachers. And over time, we helped the young people to develop some garden leader roles. And now these young people lead the sessions with sort of a teacher supervising and being on hand if anything's needed. We also delivered outdoor learning training for teachers, sort of moved from a model of a few sessions of training, then some supported delivery with us and them, and then onto them delivering their own sessions, which they are now doing both in the school grounds and out on our nature reserve nearby as well. And a few other activities there, but I think it just shows how it's amazing to build up the skills and the resources in the school. Now we're actually not working with the school very much because they are now able to run all of this themselves without any of our input. So that's really the focus of the Wildlife Trust at the moment, is to take that step back and to focus on building the skills and the connections and supporting the community to do it themselves rather than us going in and doing that for them. So green social prescribing, a few of you might have heard of this term. I think whenever I talk to people about nature and health, this always comes up. So it's a side angle of social prescribing, and it's basically the practice of supporting people to engage in nature-based interventions and activities to improve their mental and physical health. Now we have roles called social prescribing link workers that exist in the communities, and they link the healthcare sector with opportunities in the community that people can get referred into. Often lots of health conditions, there's lots of determinants of that, as sort of Emma said, socially, and so there's lots of things in the community that can support them equally, as well as things like medication or in tandem with medication. So it is part of the NHS's long-term plan to improve mental health outcomes and reduce health inequalities. So at the Wildlife Trust, I guess we've been doing this for a long time without realising we've been doing it. For example, with our volunteering programme, we have lots of people that are referred in by health professionals to come and take part, to be part of a social network, but also to be getting outside and be physically active. And a recent report from the Wildlife Trust found that the impacts of volunteering for 12 weeks, that 60% reported becoming more physically active, and new volunteers actually trebled the number of days that they were physically active by taking part, and 83% improved their mental well-being. So that's just brilliant. And I've just got a quick quote here as well from an occupational therapist that referred a young male patient into one of our volunteering sessions. He said, "I have observed X becoming more comfortable when spending time in the outdoors and particularly nature. He appears more regulated, relaxed, and overall his mental health is balanced. He's become more conversational during time on the ward, and the team feel it is the time he has spent in the community and nature reserve which may have attributed to his communication skills and regulation levels." And I'm sure lots of you that are running these types of sessions have got similar examples as well. We've also been running some sessions with a male acute ward at a mental health hospital near our site, and again running nature-based sessions that are participant-led, so bringing in their interests and then designing sessions off the back of that. And again, that had great outcomes in terms of their social connections and well-being and providing activities outside of the ward, with a few of them going on to volunteering after they'd been discharged. More recently, we've developed and run several 6-week programmes based with nature-based activities in Southeast Northumberland, and that is targeted at people who are out of work or are suffering from various health conditions, and they've both been through self-referrals, but also referrals through link workers and other health professionals as well, which has had amazing outcomes. And I think that long-term approach of having 6 weeks of activity and lots of signposting at the end, so they have lots of things that they can move into, again, has led to lots of them now volunteering and attending sessions outside of this in the community. But there are lots of barriers to green social prescribing in the North East. So we led some series of consultations earlier in the year with the health sector in Southeast Northumberland to find out what are both the challenges and the opportunities from the health professional point of view. So the major barriers were that health professionals just don't necessarily know what's going on in their area in terms of green activities and spaces that they can send people to, and finding up-to-date information was really difficult. but also that they didn't necessarily know loads about the benefits of nature for health also. In terms of the BCRC sector, there's sort of a lack of funding and resources for providers to have that capacity to support more people through social prescribing. And also there's the barriers then from the service users, especially in the Northeast, around sort of transportation issues and transport poverty to get to activities, concerns about whether things would be accessible for them, but also that confidence to attend the first session. In terms of recommendations in the report that we did, we need more awareness raising and understanding, hopefully like we did at the first section of this presentation around the power of nature for health and why it's important, but also understanding of what's going in the area and allowing people to network and find out more about opportunities available. And financial support for providers so they can increase capacity is a really big one. But then also interestingly, support and training for both the health sector so they feel like they can better connect in with the green sector, and then vice versa, the green sector wanting training and sort of workshopping and networking to understand the landscape of the health sector and where they fit in. There's lots of strands to the NHS, and I think sometimes it can be very difficult to find your place and to get in. And we're going to share a little bit later about how the partnership with the Great North Children's Hospital came about. It was a long time in the making and lots of learnings that we'll be able to share with you. So this is the programme that we are now running with the Great North Children's Hospital. So it's our youth-led eco-influencer programme that we've been in our 4th year of delivery now. And we've designed this really to tackle, as we've sort of shared in that eco distress slide earlier, to allow young people to have their voices heard, to have their say, and for them to take action with whatever they think is needed most in their area in terms of environment and social issues as well. So it's a youth-led programme, and our eco mentors support young people to design and deliver their own environmental projects, and that can be anything they want it to be. So I'll share a few examples afterwards to show the diversity of what they get up to. We do evaluate it to try and find out the impact. So participants do a form at the start of engaging with us and at the end. And we obviously do reflections in the meantime as well to see how we can improve things. But generally, we see wellbeing increasing by 18% on average, and that nature connectedness on average increases by 39% from participation. And we also see lots of other benefits from gaining skills, and the key skills that people say they gain are leadership, teamwork, event planning, fundraising and public speaking, and also increased confidence as well. Because I know a few of you are from the charity sector here, and you might be interested in how we're funded. So we have funding from the Newcastle Youth Fund to run this in Newcastle, from the Ernest Cook Trust, which is a national foundation that is really looking at outdoor learning and stuff like that. That's the thing they're really interested in. And then the National Citizen Service, NCS, who you might have heard of, that run lots of social action and skills-based programmes across the UK. So one example here is the work we've done with a group called African Community Advice Northeast, who are based in Byker in Newcastle. And when we started working with this group, they weren't super keen on the really practical, getting your hands dirty types of stuff, but they loved debating and talking about and learning about different environmental issues. So together we decided that we would develop a nature podcast, which they've called Ready, Steady, Grow. And I think it's probably in its 2nd or 3rd episode now. And that was so that they could create a platform where they could bring those discussions to a wider audience. I think they felt that lots of people in their area didn't really care about the environment, didn't really have many opportunities to learn about it. So for them, this was their way of getting that across to their community. They also had the opportunity to go to the Northeast Youth Symposium, and they spoke there about litter and green space inequalities. So where they're based in Byker is an area of high deprivation. They have got some green space, but it's not great, and there's lots of litter everywhere. But nearby in Usburn, there's a really up and coming, lovely, trendy area that's full of amazing green space and wildlife, and they live side by side. So there's a big inequality of access there. And then just another thing that they worked on is running some silent disco litter picks for their community. I think this just highlights here how it's always so important to inject fun into anything that you do. And again, there's lots of often doom and gloom around the environment, and they wanted to do something fun that might encourage more people to litter pick in their area. A different example here, so we worked with a school in North Shields in North Tyneside, and what they were really interested in was practical action. They wanted to turn their school grounds into a haven for wildlife and for people as well to enjoy it. So they created, you can see here, them digging up the turf to create a wildflower pollinator corridor along the side of their school grounds. And they also fundraised for and built a polytunnel, because in that area is an area, like sort of how they said at the start, there's lots of issues in terms of access to food, especially healthy food. So they wanted to be able to grow food that they could then put in the school's food bank for the local community to access. And lots of other things happened as well, and they got nominated for a National Environment Award, which was very exciting. So here's Steph, the teacher that was involved with Ben Fogel at the award ceremony. So yeah, that's a sort of a whistle-stop tour to a few of the things we're doing. We thought we'd add in a little quick question break, if anyone has any questions, before we go into the hospital work that we're doing. I actually can't see the Q&A or the comments because I'm sharing my screen, so somebody else might have to shout out the questions if there are any.
I am back, so anyone put their hands up if they wish to. Amelia, have you been keeping an eye on the if there's any questions on the chat?
No questions yet. There's just comments about different people's experiences of delivering some amazing work, so it'd be really good to hear about about their projects later on in the call. So, but yeah, all really interesting.
Fantastic. I'd also like to piggyback on you, Amelia. Silent disco little pit. What a fantastic idea that is. Dance while you pick up litter. I love that.
I know, I think we should all be doing that.
Yeah. And the other thing, just to sort of pass comment on and not necessarily to ask a question. Well, it is a question. There you go. I was about to say when I've came back on, I just heard that some of your activities, which I think were for slightly older people, perhaps the 6-week program. I mean, 83%, I've written it down, increase in mental well-being and a 60% increase in activity in those in that 6-week program. I mean, if you could bottle that and give it to the NHS and we gave it to everybody, I mean, that is just phenomenal, actually, that. But obviously then in the children's program, it's slightly different. It was sort of 18%, which is not to be sniffed at. And nature connectedness, 40%. So what's the difference between the interventions in terms of why do you see sort of differences there? And do you have thoughts that is it a medical speak, dose response, isn't it? You know, how much time they spend in a project, or is there something about the project that gives you that slightly different impact?
I think some of it depends on the base levels as well of the people involved and the base level of well-being and nature connectedness that they start on. So the stats that you talked about from the adults, that was from analysis of 12 weeks of Wildlife Trust volunteering nationally. And so that would have been adults probably doing very practical things outside in a group. Whereas the work that we're doing with the young people, we do sort of like hourly sessions once a week as a group. And they run through a whole process of starting off initially of understanding a bit more about the local context, what's happening in the local environment, social issues, and then moving on to actually then designing a project to tackle that and then delivering that project. So perhaps that it's the slightly less time that they're doing in it, but also when you're in a school or a youth group context, doing those really practical activities can be a little bit more difficult. And when we go into a hospital ward context, for example, it's even more difficult again to do really practical activities that these adults that were volunteering could do out on nature reserves, like tree planting and that sort of thing. Did someone have their hand up earlier for a question?
Sorry, I was going to say that there's 2 questions in the chat and one hand up. I'll just take one from the chat and then we'll go to, I'm sure that's Helen in a minute. So the partnership with schools, is that a free service for schools to sign up to? Who's it funded by? Someone might be interested in there. I think it's Kendra.
Yeah, so it is a free service at the moment. We were thinking about making it more financially sustainable and putting costs on it. But feedback we had from schools is that, especially in this area, budgets are very tight and they found it very difficult. And so trying to work with the groups that were most in need, and we were struggling with that if we put a cost on it. So they are free at the moment. It's funded via our core funding at Northumberland Wildlife Trust, which essentially comes from our membership, large donors, corporate partnerships, that sort of thing.
Fantastic. Kendra, has that answered your question? I know your second hand up there, but has that helped you, or have you got a supplemental question on that?
No, thank you very much. Is that on the mic?
Good. Fantastic.
Yeah.
Thank you,
and
Kendra.
Just may I add another bit to that question?
Yes.
How do you that partnership, that relationship with the schools, is that something that you sort of come in and say, this is sort of a service that we can offer, costs are covered, or have you found challenges within the schools, sort of this idea of having to give up curriculum time, timetable time, all this kind of stuff, this alternative?
Yeah. Route? So I guess the first bit's around how do we get into the schools to start with, and how do we pitch it? So a mixture of different ways. A lot of it now, because we've been doing this for a while, is people actually getting in touch with us now. So we're sort of reacting to the inquiries that come in. And where it's worked better is where we have existing relationships, or people have sort of referred them on to us. So for example, a lot of the groups that we work with through the Eco Influencer program, which is an easy pitch because there's direct involvement from us and there's funding involved as well. Often that then leads on to connections with our education teams. They can do stuff more widely in the school around curriculum and that sort of thing. We've also tried to do more networking and attending events this year. So for example, on Thursday I'm going to a Net Zero Hero event, which is organised by the council, and there's about 30 different primary schools going there. And we found formats like that is a really good way to connect with the teachers that are really interested and trying to do this work in their schools already. And often, unfortunately, we found in schools is that the ones that are doing it well are the ones that have got those really passionate teachers, but they don't necessarily have that support system in school. So that's where the upskilling can really help to do that. So hopefully that answers that first question. And then the second one.
We'll take one from Helen Eston Jones, if that's all right. Helen, do you want to unmute and pose your question?
Hi, yeah, thanks. That's very inspiring. I'm a Newcastle resident, but I'm a Gateshead paediatrician. So I noticed that you cover Northumberland, Newcastle, North Tyneside. Who's your equivalent in Gateshead that I can get in touch with? Because this is all very inspiring.
Yeah, so it'll be Durham Wildlife Trust. Durham Wildlife Trust, yeah, operates in Gateshead and then below, like south of Tyne area.
Fantastic. Thank you so much. Brilliant.
No worries.
We'll move on because I think for interest of time, but we'll take the questions. There's one more in the chat when I'll try and pose it if we have time as well. Okay. So if that's
perfect. Okay, well, thank you, everybody. And I'll hand over to Emma now, who's going to talk more about this, but in the context of hospitals.
Thanks, Liz. Yeah, it's lovely to hear everyone's enthusiasm for the topic, isn't it? So yeah, I'm just going to briefly touch on sustainability nature in a hospital setting or for hospital users, and then focus on this Great North Children's Eco Influencers partnership with Northumberland Wildlife Trust. So next slide, please. So just to sort of mention in terms of context briefly, that sort of in recognition of the impact that the health service has on the environment, largely in terms of carbon, but also other environmental impacts like plastics, pharmaceutical waste, etc. I'm sure you'll be aware there's now been lots of different green plans at different levels from different organisations, so they're worth a read if you haven't already seen them. And just to mention sort of locally in Newcastle, in 2019, so a little while back now to be fair, Newcastle Hospitals became the first healthcare organisation in the world to declare a climate emergency. and in partnering with the Council of University, became the first city in the UK to have all 3 anchor organisations declare that and have a plan. And our climate emergency plan has a number of different themes running through it. I just wanted to draw out that there's one around like buildings and land, I think, which includes biodiversity and green space, but also one around people. And they draw out that we need to be engaging different stakeholders, but including our service users as stakeholders in sustainable action. So this partnership and project, I feel, really bridges those 2 areas, the sort of nature protection and sustainable action, and empowerment of young people for sustainability. And so to lead into it, Gracie's just going to share a little bit about what she enjoys about being in nature.
What do you enjoy doing when we're out in nature?
I like climbing trees and hanging off them, and I like exploring and looking for different animals.
So as Gracie described there, and Liz has talked about through all the fantastic work that Northumberland Wildlife Trust are doing, a lot of the evidence about the benefits of nature come from actually being in a green space, immersed in that environment, being active, socialising in nature. So sort of thinking about that in terms of hospital users, one thing to think about is nearby green space. So for example, I understand that historically Newcastle Hospitals was moved to be near to Leazes Park in recognition of that. And within our trust, our arts department do fantastic nature-based events throughout the year in Springbank Pavilion at Leazes Park for staff, public and patients. And then the other thing to think of is, increasing creation and recognition and utilisation of hospital green spaces. And in a number of cases now, these areas are being used for horticultural or ecotherapy to aid recovery. Predominantly adult mental health services, but spreading more into children's services and more widely. And again, just to mention, in a Newcastle Trust, we've got a Green the Grey strategy and a biodiversity strategy. And for example, there are 2 new outdoor gardens planned, a sensory garden, and also conversion of our current children's outpatient sort of play area, which is the middle section there with my daughter at the top of a climbing frame, which is great, but very much lacking in green. Remember, it's a city centre hospital, and there are some fantastic plans in terms of that have been co-designed with young people about converting that to a lovely green space. So next slide, please. So I'm just wiggling down a bit. But so we also know that alongside sort of actual physical green space use, actually viewing nature or nature pictures can decrease perioperative anxiety, the length of hospital stay after surgery, pain, and improve well-being and hospital experience. And specifically, we know, for example, things like room with a view, natural light can reduce anxiety for children in hospital. And also that young people like natural environments, natural materials in terms of their sort of emotional regulation in hospital. So next slide, please. But as Mike mentioned, I think at the start, there are a lot of challenges to this, both sort of active green space in terms of hospital and biophilic design things. So, hospital location and design isn't necessarily easy to change in terms of nearby green spaces, view, etc. Also, many young people might not be able to access nearby or hospital green spaces, and that can be for a range of reasons. There might be, as we mentioned, hospital circumstances. So these green spaces take a hell of a lot of planning, resources, space, etc. to set up. But also there might be other system things coming into play. So, for example, those photos on the right are my son, 2-year-old son, was admitted recently to the Great North Children's Hospital. And that was our view from our first room onto the car park. And because of infection control reasons, he was stuck in that room for basically 3 days. So the bottom picture is me walking to Leazes Park and getting some nature things to come and bring to him. But again, we touched on sort of social barriers to green spaces. There's a whole range of health barriers there as well. So that might be fatigue, pain, various mobility or accessibility issues, And then time is a big thing as well, either for inpatients, if they're having sort of intense treatment or investigation regimens, or even for outpatients as well. And then again, in terms of sort of natural environments and materials, again, there's often lots of hoops for changing these things. It's not as easy as it sounds. So Gracie's just going to do another little video to mention about her health and also her hospital visit.
I have Crohn's disease and I have to take tablets every day and once a day. And every 6 weeks I have to go to the hospital and have an infusion which lasts half a day. But since it's in Newcastle, I take the whole day off school.
What is it like on ward 2B?
It's nice. It can be a bit like boring sometimes.
So this is really where bedside nature engagement comes into its own. It's sort of building on that visual and passive connection with nature in hospitals, and the fact that we know diversional activities, including sort of art and play, can positively affect a child's experience in hospital. And it's allowing more active sensory engagement in nature, but at the bedside for children and young people who might struggle to access green and blue spaces. And we know that this sort of connection still has impacts on physical and particularly mental health and well-being. And they can support pro-conservation behaviours and holistic life skills again. And, at a time when everything's in crisis, climate, ecological, financial, these sort of approaches benefit from being scalable, low cost and low carbon. And they can also act as a micro approach to inequalities in access to nature. So next slide, please. And we need to remember, getting sick and going to hospital, inpatient or outpatient, can be a significant stressor, particularly for children and young people. And as Grace has said, it can just be boring if you're stuck there. And in terms of sort of responding to patient voice, in the last CQC Children and Young People survey, less than half of children and young people said there are enough things for them to do in hospital. There's often a focus on young children in paediatric settings, I feel, but we also know that for adolescents being in hospital, contact with nature and the beauty of nature and normality is really important. And then sort of broader than just health, there's been a number of national nature surveys recently, and over half of young people want better access to nature, but specifically, vast majority enjoy being in and connecting with nature and also want to do more to look after the environment. So we really want to harness that. The next slide, please. So in terms of this partnership and project, we wanted to sort of gauge staff feelings before planning ahead with anything. So we did a bit of a survey with paediatric nurses and allied healthcare professionals, so play therapists, OTs, etc. of about, I think there was 43 respondents. And there was overwhelming support, recognition of the myriad of benefits of nature for this specific patient population, for want of a better word, on the ward. And the word cloud there shows a number of benefits that people drew out. And some of the things that they said were things like, particularly in the context of the city centre hospital, and particularly for these young people with chronic illnesses who keep having to come back and staying for a number of time, for a long time, sorry. So next slide, please. And we also wanted to make space to explore any barriers. And the main things that came out there were about resources, knowledge, and staff time and roles in terms of who would deliver that. So we've thought about that in our sort of sustainability planning, in terms of sustainability of change. So all but one would support this sort of activity on the ward. The only other thing to mention is more through informal discussions. I think there is sometimes this view that it's a bit more wishy-washy in terms of outputs or outcomes, and that's why having this sort of nature connection index and wellbeing measures that Liz talked about sort of inbuilt into this programme is really helpful. So next slide, please, Liz. The other thing, which I guess is not surprising, is that despite overwhelming support, the confidence for delivering this sort of nature connection activities independently was very low. But in a good way, 3/4 were keen to take up further training if offered. So next slide again, please, Liz. So I just thought we'd share very, very briefly our project pathway in case it's helpful for others looking to do something similar. So In terms of the partnership, I met with Liz and a colleague at the Faculty of Sustainable Healthcare Conference back in September last year, which is a regional sustainability healthcare group, which I would sort of signpost people towards separately. But we didn't start the project until July this year, so you can see how long it's taken us, basically. And the main learning point there was just stakeholder engagement was so key. Lots of different people to talk to and discuss things with and scope out how we would do this. And we got help from our trust engagement leads. And one thing just to mention there in terms of engagement with young people is a good sort of rule for thumb that I think is helpful to share is to try and think about a third your agenda, a third the young people's agenda, and a third fun, which links back again to Liz's example of a silent disco litter pick. And we work very closely, for example, with information governance on sort of data protection and making joint information leaflets and joint consent and assent forms, for example. And then we sort of came to land on doing weekly sessions with young people on the day unit as a sort of bridge between inpatient and outpatient. And again, with young people with chronic conditions who are coming back regularly and often stuck in hospital for a fair while. So Gracie's just going to share how and why she became involved in the project.
They came into the hospital one day, and I thought it was pretty cool how they had all this stuff from like nature that you couldn't normally get.
So far we've had 7 young people sign up, enrolled as eco-influencers, and 6 of whom have completed the starter survey. 3 people were happy to share their postcodes from which we calculated deprivation scores, which were 9, 5, and 5, but we haven't got that information for all participants. And in terms of skills that the young people were hoping to gain, they're shown on that slide, but team working was the predominant skill that people wanted to develop. And often a lot of young people wanted to focus on the welfare and protection of wild animals and sea creatures also. And here's a summary of the Wellbeing and Nature Connection, or Adaptive Nature Connection indices. And you can see with sort of average scores, for each question. And you can see that in the Wellbeing at the starter, strategies to manage emotions and making friends easily were identified as particular challenges for young people. And I feel part of nature also coming out scoring quite low in terms of nature connection. So we're really hoping that we can increase those through the project. The next slide, thanks, Liz. And then as we kind of alluded to, it's a very different setting than community projects that have been run previously. So we had to think about how we would do that and adapt it. So we landed on to start with discussions with the young people, obviously, because it's youth-led, collaborative project where the young people have been learning about pollinators and then making these beautiful pebbles, which they've created with pollinators and wildlife on, that they're then going to use as a nature trail, perhaps around the ward, before hopefully going into one of our new sensory gardens with hopefully linking to some information on those insects and animals. And I just mentioned quickly there in the butterfly one, apparently the young person who did that one was didn't really said she enjoyed nature, didn't seem that interested, a little bit hard to engage with. And then when this creative project came up, her ears perked up, she got really involved, engaged, and has actually booked her return treatment appointments to coincide with the Eco-Influencers project. So I think that's a really lovely example of reaching people who might not otherwise think that they like and have benefit from nature. The young people are also wanting to think about how we have resources to stay on the ward, in terms of books, but also they're exploring trapping natural resources in resin to try and overcome some of the infection control issues that might crop up. And they're also going to make a climate change wall display. And then more broadly, some of the young people are having opportunities to be involved in sort of media interest. Gracie is a co-author on an abstract that we've submitted to a paediatric conference, and we're also hoping to make more links with the hospital's art department and community projects. So Gracie's just going to do a quick video about highlights of the project. so far?
We learned about pollinators, and then we learned about bats, and my favourite bits were they bring in these stone things to make a trail in the hospital, and I like decorating those.
So we're still sort of early-ish days, but in terms of what's next, one of the things is that all participants so far are white females and have English as their first language, which may be an element of the nature of the beast in terms of who's there, but would be keen to try and diversify our participants if we're able and thinking about ways to do that. The other big thing which we've mentioned is about sustaining change. So I think the honorary contract for Rhiannon there, who's coming in to facilitate these sessions from Northumberland Wildlife Trust, runs for 12 months as it stands. So we're looking to put some training in from the education department at Northumberland Wildlife Trust for play therapists, hospital school teachers, and also, as I mentioned, create some of those ward resources. So I think that's the end of the whistle-stop tour about that partnership and project so far. Again, any quick questions for me or Liz about that before we go on to sort of a wider sharing?
Thank you. Amelia, anything in the chat that you've seen?
Yes. So Louise has asked about examples of bedside nature engagement activities. She's put that we often have hoops to jump through with infection prevention and which can create challenges in getting nature-based bits into wards.
Yeah, thanks for that question. This was something that we discussed a lot about, and with our both infection control team, but also paediatric microbiologists. Interestingly, they were both very, very supportive of the project as a whole, and didn't feel that there was a lot of barriers actually to having natural objects, soil, etc. on the ward for the majority of patient groups. When we were talking about it with them, they were mainly saying things like, as long as there's good hand hygiene, nail hygiene, that's one of the most important things. There are options to use things like gardening gloves, if that's helpful, with the other sort of main proviso that those sort of potential contaminants don't come into contact with any breaks in the skin or lines. So, for example, a lot of these young people are coming in to have infusions, so they may have cannulas or lines. So that would be a big thing to think about. But it was very much not a no-no. It was like, how can we make this work? And they saw the benefits of that. I guess the only other thing there to stress again is it does depend on the patient population. So I think this group, now I'm going to get my words mixed up. There are often these young people are on immuno sort of modulators, but they're not they wouldn't be classed as immunocompromised. Whereas certain patient groups, if they're immunocompromised fully, you might have to be a lot more cautious. But again, interestingly, because of some concerns still lingering around infection control, so far, Rhiannon, who's been coming to facilitate the sessions, we've decided to steer clear of seed planting at the bedside, for example, which you could do, and this is why I mentioned about sort of capturing pine cones or pressed flowers in resin so that they're easy to clean, etc. So you can do other things that avoid that. And so, for example, she's also brought in insect specimens in containers, which apparently the young people really engaged with and really enjoyed. So I think I really wouldn't see it as, I understand it could be seen as a barrier, but I think it's just about discussion with the right people and finding the right ways to work around it. And I think there are lots of different solutions.
I'd just add to that. So Rhiannon is actually watching today, who's running the sessions. Yeah. So I wonder, Rhiannon, if you're able to write in the chat some of the examples of activities that you've done on the ward, for example, with bat detectors and wildlife cameras and that sort of thing, because I think that might be helpful to answer the question of, it's actually really difficult to come up with ideas of what to do in that setting. And I know as a team, we did lots of brainstorming to come up with different ways we could do that. And if we're to create some sort of box to continue nature engagement in the ward, what we could include in that. Because it's very different to the settings that we're normally working in. So Rhiannon, if you are able to do that, that'd be really helpful.
Thank you. And that would link, Amelia, to Chris's question, I think. I've noticed that, Chris, I'll read it out, but do add if you haven't captured this right. So what do you think the best way of linking nature and arts agenda in schools? Because there won't be quite the same barriers, but I imagine there's barriers there. So, and I know with a busy curriculum and time to do it, probably that's one of the biggest barriers, but there may be other barriers. So what do you think the best way of getting into schools? Perhaps it's already been touched on, and that's probably one for Liz, I guess.
Yeah, I was going to say, is that in the community or in hospital? Because we have also had discussions with our hospital school teachers, but obviously that's a very different setting.
I imagine it's aimed at schools, the wider schools, but the same could apply for hospital schools as well to some extent.
Yeah.
Probably one for Liz.
Was that nature and arts, did you say in the question?
Nature and arts into school.
Yeah. I think the ways that we've found best to get it integrated into schools is there's a few different ways. One is through green careers with the older age groups. Schools have got lots of targets around that. And so anything where you can come in and talk about careers but then link other activities works well. If they already have extracurricular groups that exist, like eco clubs, or other similar groups that it could link in with, or then just in terms of actual curriculum is sharing real examples of how it could link into the curriculum. So you've got to go and look at the curriculums and the learning outcomes, and then link those learning outcomes to things that you could deliver in a nature-based context. So it's a little bit of homework to come up with that, to develop that. But then also opportunities for trips, and often schools have at the end of a year, they'll have some sort of volunteering or social action week. I know a lot of the secondary schools near us do. So linking into that week, we found to be really good way to engage lots of people. And also the wellbeing angle. Schools are looking at lots of ways to better support the well-being of their pupils, or pupils that are struggling with behaviour. So they're willing to put more resource and time into alternative things that can help with that, we've found. So a few different angles there.
Can I just add into that, just for interest? Oh, sorry. Did you have a follow-up, Chris?
Yeah, it was just a quick follow-up. It was much more about how do you get the arts to partner with nature themes. At the moment, we have siloed funding streams. We have a nature funding stream and an arts funding stream. Bringing the two together, because there is a joint interest, and yes, you picked it up in terms of the hospital work, in terms of beginning to think about working with the arts leads in Great North Children's Hospital, but it more widely, particularly in our more disadvantaged schools, which are the schools that are more often struggling with high levels of teacher turnover, lots of pupil absence, etc. And so linking the two together is a bit of a challenge.
Yeah, I think it's a challenge and opportunity. We found that actually a lot of the young people we've worked with, where they are wanting to help solve environmental things, they're wanting to do in a really creative way. So lots of them, for example, have created art murals or sort of creative things from nature podcasts. To actually, we worked with a theatre group who did a sort of a theatre performance that displayed their feelings around the climate crisis. So that's a way to link it in, I think. Yeah, so we haven't done loads, particularly with art departments. I think the arts more come out as secondary parts of the other work that we've done. Yeah, sorry, I don't know if that's a great answer to your question. But yeah, I think linking the two together is showing the crossover and how creativity is really important in the context of nature. And actually in nature, sometimes people are more creative as well.
I just really quickly, sorry, I'm not trying to hijack, it's just all very interesting. So I'm very busy on the chat, but I'm a Green Spaces coordinator and I work for North Bristol NHS Trust, and that's kind of part of my role. So I've got kind of a background in the outdoorsy stuff, forest school stuff, and I lead a lot of kind of patient engagement on our hospital site. But I think one thing which is really key is providing your arts team. So we have a fresh arts on prescription service here at the hospital that patients go through, and one of the main things which we're going to do is provide training for those guys about how they can develop arts programs to involve nature in them. So that is one thing, which I suppose just could act as like a linking mechanism, but my role is funded under the NHS charities hospitals together. So yeah, it's kind of funding that's coming through the hospital charities. So I sit in between the sustainability team in the hospital, and then I also work really closely with the arts on prescription team as well. So I don't know, maybe that might just offer some support in terms of how you link those two things together.
That's great. I think it's a good example there, and I love the word fresh arts on prescription. Was there any more questions around that? Sorry, I still can't see the chat.
I was just saying I didn't mute and dismute. Louise, I think that's a really good thought there, and also interesting to hear about your funding. There is a need, isn't there, to bind people, and I think a training of people who work, key workers, social workers or whatever, who are supporting children and young people, whether it's in hospitals or other health settings, and having some specific training about access to arts, and bringing green and nature work into that is really interesting. So that sounds brilliant to me. Emma, last comment before we move on, is that okay?
I was just going to jump in and say it is hard in terms of funding streams though, isn't it? Because we did speak to some link workers within the hospital who are already doing fantastic work with children and young people with neurological conditions, and but they were quite limited to their age range also, and we also on our side, and we were sort of at opposite ends, but I don't know if there's an easy way around that. I guess it's more just kind of trying to take opportunities as they come and make sure you're making those networks and find where you can work together, maybe.
Yeah, and I think each region will have very different funding mechanisms. Like ours is a real grouping of the different kind of what's going on in the locality. So I think that's something to look at. But I don't know, I think also in terms of when applying for those funding streams, there's so much going on at the ICB level around how this stuff is really important. And if you can find someone internal within the NHS who sits at that kind of ICB strategy level to get on board with that, then it can really support in terms of how you can link all of this amazing nature work into the kind of bigger strategy goals which is going on. So yeah, definitely learning. We're all learning.
Absolutely, and it's a very good point, because some temporary funding is temporary, isn't it? And if an enthusiast moves on, it risks it all sort of folding, doesn't it? So building it into our systems, and I think Chris has given us a big nudge there towards saying the same for the arts and nature work. There could be a really nice synergy there. So we move on, if that's okay. Amelia, happy for us to move on now?
Yeah, and how we can go back to some of the other questions, so that's excellent. Fine.
And in terms of timing, because I missed a fair chunk, how are we doing for timing? Are we all right?
Yeah, we're a little bit over, but that's fine because we've got the questions threaded through, so that's okay.
Excellent.
Yeah, and we're basically at the end now. There's just a thinking about what we can do next, and then just we've created some space at the end for, because I know there's lots of people doing work around this, just to share what they're doing, opportunities, challenges, that sort of thing. So perhaps we won't do this slide now, but it's something you could take away and do afterwards if you wanted to. But it's a really nice Venn diagram to try and find your niche, whether it's within your role in your organisation or in your personal life around what climate action to do. So thinking about what do you enjoy doing, what needs to be done, what skills do you have, and then you can create these circles and find where that sort of overlaps in the middle. And I mean, just an example, somebody that I used to work with was a really keen paddleboarder, loved paddleboarding, and got cancer from quite an early age, is in remission now, but got a lot of solace from paddleboarding out on the water. But whilst she was paddleboarding, she noticed that there was lots of litter absolutely everywhere, and in sort of birds' nests and that sort of thing. So realised she wanted to do something about that. So that's what needs to be done. And then in terms of what skills did she have? She was working in a marketing agency, so was really good with social media and reaching people in different ways. So she started an online community called Planet Patrol, of people taking photos of litter and tracking what they found to try and build data on the types and brands of litter. So sort of her action of bringing everything together there was to set up a community and an app for people to track litter through citizen science. So that's a nice example of sort of bringing all those things together. So yeah, maybe we don't do this now because of time, but something, if you're trying to think about what can I do, how can I help, something you could go away and do. But yeah, I think now sort of over to everybody else. Is there anything that people want to share in terms of examples of projects or opportunities, any resources that they found that have been really helpful, both for organisations and the people on the call, but also the young people themselves as well? I might stop sharing my screen so we can see everyone easier.
Fantastic. So firstly, a huge thank you. We've got a little bit of time for one or two more questions, I think. And any thoughts about sharing and making connections, because that's part of this work. So first hand up, Kendra.
Hi, sorry, I feel like I'm like a eager beaver here. I'd love to hear your thoughts on this, because we're kind of at this bit of a crossroads. And Liz, yeah, I'll probably be in touch again because I'd love to hear more. We're a non-profit, and we use outdoor spaces of council-run buildings. So very urban settings like Shiremore Metro Station, Riverside in North Shields as well, and sort of looking at, I guess we're trying to sort of break those misconceptions. Also, what is nature? So a lot of times, you know, people think, oh, well, I need a garden or whatever, but it's literally the tree that's next to the bus stop. It doesn't have to be, you know, a plot of land as such. So it's, I suppose, if anybody has any, I don't know, input or whatever, please let me know. So it's kind of this idea as well as giving, so we run forest school stuff, but we also do a lot of like we're working with occupational therapists, and we're sort of working on a program where we can have speech and language therapists and everything. And so we're outside of these community-based health workers and mental health teams and all these wonderful things, but yet somehow that bridging that gap seems to be more complicated than it needs to be. And so we're trying to say, like, well, come outside with your patients or your service users or whatever that are coming to visit you indoors, and see how we can kind of work together and stuff. There's obviously like safeguarding, confidentiality stuff. So there's a lot of, you know, red tape that needs to be sorted. But I guess the other side is, and maybe this is more of a structural thing, but the idea that obviously hospitals are different, but that the therapists or the professionals, the experts, that they hold the power as far as access to that service goes. So for example, if somebody has to, you know, somebody has a therapy session, that they go to that office, and if until the next appointment, they can't access that person or that support. But if you could sort of, I know this is very idealistic, but like if we could bring more things outdoors, it might be a case of, you might not see that therapist, for example, for another 6 weeks or so, but you can still access that public park, or you can still access that environment where you get that support. I don't know if I'm just rambling.
Well, I think it's brilliant to raise that question. It's about the concept. There's a lot of evidence now around forest schools, aren't there? What about forest health? I don't know. And do we start to challenge our tradition, which is you come, you know, for patients, let's call them that, for people who have a health issue, that they come to the professional as opposed to the other way round. Now, there's obviously efficiencies and logistics within that, but it's a really nice thought actually, because maybe we should be doing some of our, for example, for me doing my asthma clinic in the park. Could it work? Could you do these sorts of things? And why the hell not? I mean, it needs a shift in thinking somehow. And this concept of social prescribing, which I know people on this call will know far better than me, but actually, can we just get over the barriers and say, actually, the voluntary sector who do an awful lot of work on health and well-being, that actually we join up together somehow, so that we can create those, those neat connections. When it does work, when you have people like Liz and her team coming into the hospital, you can start to see those connections having a bit of power, and maybe actually, instead of us needing 10 more doctors or 20 more nurses in our hospital, we need a bit more than that, by the way, but maybe we should need 8 more doctors and 2 or 3 more workers who are skilled in bringing nature in and taking children out into nature, because it might be more effective. We do need to challenge our thinking when it comes to our child health and our National Health Service. What is it? So I really like that question, Kendra. I don't know the answer to it, except we've got to keep walking this path and hoping that we can grow those links and keep fighting for them. It feels like it's a time of change for me in the NHS, and I think there may be opportunities, and we've just got to be ready to grab them. But thank you for raising the question. We'll move on if that's okay. Jill.
Yeah, hi. It was really great to hear about all this good work in kind of connecting children and young people to nature. I wanted to make a broader point, which kind of links to the great work you're doing around young people being eco-influencers. And there's quite a lot of research in terms of young people's eco-distress and that sense of doom and being very worried about the future, that actually being in touch with other young people who are doing something to change things, as well as being in connection with the nature that is around us, seems really important. And the other aspect, I think, is to know that we as adults are also doing all we can to try and actually address the climate catastrophe, rather than just try and look after ourselves in it. Both are important. So I was going to just put a couple of things in the chat, which I didn't want to usurp anything, but just local things that are happening that you may find that teenagers you work with or families you work with, where parents are wanting to do something with their young people to show that we are at least connected and together in trying to do things. And I think that's an important part of this equation. So I'll just put those, but they're very much Northeast things that I'll just pop in the chat. Thank you.
Thank you, Jill. And we appreciate your work that you're doing and leading the way in Northumberland. So keep it up, power to your work there. John, you've been very patient. I know you'd asked a question earlier, which I was going to come back to, about barriers, but maybe you want to ask another one or build on that. Over to you, John.
Yeah, thanks, Michael. My name's John. We've got a project in Northumberland on a farm, primarily working with young people with alternative education, but we also do funded holiday activity clubs, and we also do educational farm visits. For me, I would say working with special schools is much easier than mainstream schools. There feels like there's a lot more flexibility in the curriculum, and the few mainstream schools that we have managed to work with, it's been primarily alternative education. It feels like to kind of get what we want to offer into the curriculum is quite a challenge, because it's so structured and so rigid. So I just wanted to offer that, but also to say I'm very happy to be part of the network. So thanks for letting me be part of it. So thanks.
You're most welcome, John. And of course, farms have got a history of doing this now, and probably good processes in place, and are still, particularly around the Northeast. It's a massive resource that we've got to look after and value. And of course, the more people engage with it, the better, I'm sure. So thanks for sharing that. I think Louise may be next.
Sorry, I know I'm taking up loads of space on this. Just very, very interested. And I think coming from like just building on what Kendra was asking about, I think coming from an internal place of working inside the NHS, I'm definitely seeing that there's a huge amount of cultural change which needs to take place in order to kind of drive this like movement towards more nature connections in hospitals and in acute settings. And I think the primary network has really kind of, you've got your amazing social prescribing link workers, and you've got that kind of the GPs really acting as that, and it can be really challenging in secondary care and in acute medical care. I think from my experience, it does feel like an absolutely mammoth task, and sometimes it can be really kind of just like it's a whole system that needs to change. But actually, if we look at it like that, it can be really immobilizing. I think building really personal relationships with people, and you'll find that you'll have your allies within certain trusts or within certain organizations who will just go above and beyond to help you try and make things happen. And what I'm finding is that actually focusing on a lot less with a lot more passionate people is way more effective than trying to run with kind of loads of change across a whole system. So definitely those kind of like building really personal relationships, and you'll find that there's a really amazing project at UHBW, which is the Western Group's hospital. They are partnered with an organisation called Alive Activities, and they do outdoors nature engagement work with elder people, and they're doing some really amazing work with the dementia and delirium teams within the hospital, and they take nature stuff into hospital courtyards, and then people come down from their wards and engage with the work there, and so much of that has just been pushed because there's one nurse on that ward who is really, really passionate about it, and she's now been given a day off a week, or been granted a day a week to go and set this up at another hospital. So it's just kind of the power of when you get these really incredible allies who are really passionate and kind of what they can do and how they can push it. And once that gets built there, it's like, well, why can't we do that here? You're coming across all these barriers and all this like red tape, which is like, no, but what about this? What about that? And it's like, well, other people are doing it. And I think if you can find evidence for other people doing this stuff, then that can be super, super powerful as well. So I think just, sharing case studies and having networks like this are really, really valuable for people, because I think sometimes, especially when you're working internally in the NHS, or if you're working internally in schools, and my background is from the third sector and from the charity sector, so I'm very much like banging on doors, feeling quite alone in it, so I think having these networks where people can come together and share their ideas and share their challenges and discuss them and talk about them and make those connections is super, super valuable. So yeah, just huge thanks for you guys for putting this on today. It's been really useful.
Thank you, Louise, and stay connected to us, because Bristol's got a fine hospital there, and your work, please do share it and continue to share it, as we will ours, because the whole phrase, and it takes a community to raise a child, doesn't it? And it really does. And finding your allies, I think, is really wise words and good tips there, so thank you. Patrick.
Hello.
Yep, we can hear you, Patrick.
Oh, good. So basically, I work as an emotional health and wellbeing practitioner in the Redcar Cleveland area, which is a bit further south than Newcastle, isn't it? But what we found is that a lot of the work we do is primarily community based, and we don't really interact too much with NHS hospital staff, that sort of thing. And we found that it can be quite difficult in terms of access and support in schools. There's another branch of the organisation does outdoor activities and those sort of things, sort of like emotional wellness in the outdoors, that sort of thing. And they're also finding it quite difficult to go inside of schools, and that's primarily because a lot of the funding isn't really there for them, and a lot of funding's being prioritised in other areas. So what we've kind of thought about is kind of putting this together as a package in which myself and my colleagues would go into provide one-to-one support on an emotional health and wellbeing basis, but also provide kind of group and community activities in a kind of wellness activity. And I think we've contacted about 30 something schools within the area, like within a 20-mile radius, and I think we've only had about 2 or 3 that have responded, and unfortunately I think they're really not too sure if they can fund it either, but they are interested. And I think you were right in what you said in terms of the ethos shift, in terms of how it's kind of viewed in society, how it's kind of viewed in kind of public structures like the NHS and stuff, because I think until that really changes and the kind of curriculums there to kind of incorporate those sort of services, I don't think there will be much change in that setting, if you get what I mean.
Yeah, I think funding for these activities is always going to be a problem until we built an evidence base which can really demonstrate that it's efficient and effective. So I think projects like Liz and Emma are doing, so important to get the outcomes and understand those outcomes. And if we ever really clever enough to do health economics as well, because ultimately there's an economical argument to this, which we need to be brave enough to extract and able to extract as well. And I know other people have done this with lots of different activities, so we need to be doing the same as well. Patrick, the only thing I can say is stay connected to our network, and we sort of keep banging the drum and do look for these opportunities, because the government have said there's going to be a shift, isn't there, towards more community work, and trying to prevention and early intervention agenda is quite strong now. And it strikes us that wellbeing activities and emotional wellbeing is so vitally important to the children and young people we work with. And I know schools are really, I suspect the teachers would be really on board with all of this, but they are probably, I'm guessing, feeling slightly overwhelmed as well. But I don't think we should be giving up at all. But thank you for sharing your comments.
Mike, is this a good point to share the NHS consultation that's out right now, where it's a chance for organisations and communities to have their say?
Yeah, I was going to. We'll take the last question, and then we'll probably come winding up, and then I was going to tell you about this consultation process for anybody before we then close. So, Danny.
Hey everyone, I just wanted to just feed into some of the things that some of the people have been saying, and also talk a little bit about what we've been doing. So I totally agree, this network's like great for getting like a wider view, because so I run the early years, or lead on the early years work within RISE, so we are the partnership that covers Northumberland Tyne and Way, and we're doing quite a big project called Step Outdoors, which is basically using nature-based outdoor play to support really young children's educational development and health outcomes. And it works in two ways. We work with families and children directly in really targeted areas where people statistically face health and educational inequalities, but also working with the professionals that work with the children through nurseries and schools to help them to integrate outdoor learning in what they're doing and outdoor play in what they're doing, but also having that piece around like supporting parents to be able to use their local green spaces, have the confidence to do that, to know what to do to support their children. So just through some of our work with kind of schools and things, I think what we found in terms of getting in there with them has been kind of spending like what Louise said about finding your allies, but also building the relationships over time, kind of with multiple things, but really kind of finding out what their priorities are and what their criteria are, what is going on in their school, and then how they can use activity, in our case, or outdoor play to meet their own criteria. And it's probably similar in healthcare. We've got like another branch of our organisation who works quite heavily in healthcare with adults. So it will be really cool to be able to bring some of the outdoor kids stuff that I'm doing into healthcare as well. So yeah, just some thoughts really about what we've been talking about. And we also have a job out at the moment for an early years outdoor facilitator. If anyone in your networks would be interested, I can put a link in the chat. It closes on Sunday. But that's to deliver some of our work through the North East Combined Authority with relation to this Step Outdoors work.
Fantastic. And it might be appropriate, Amelia might be able to help connect you to our wider network if you are able to do that, Amelia. We've had some really nice comments there and thinking about and people doing different things. Patrick, I hope that gives you a little bit of hope that persistence that Danny's organisation's done is building those links, and that builds on what Louise was saying. There's something about personal relationships and understanding the organisation, which Liz and Emma have talked eloquently about. Before we close and anyone ask any final comments, I'm just going to tell you a little bit about the consultation and then ask Emma and Liz if they have any final thoughts before we close. So you'll be aware that the NHS, following the Darcy review, saying we were all a little upset by some of the language. The NHS is broken. Well, it depends what you define as broken. I suspect I'd prefer to say we're limping quite badly at times, but I don't think we're broken. But there was a sense that, you know, there really has to be some fundamental changes. We cannot possibly carry on the way we are. And I think there's truth in that. So there's a consultation going on. And if you just put nhs.change into a Google search, it'll take you to the website. I would really, there's lots of things you can do, and that lovely Venn diagram that Liz showed and looking at your skills, but I would suggest that all of us have a responsibility to contribute to this change. It's your NHS, it's my NHS. Basically, this isn't about a time to whinge and say what the problem is. The Secretary of State for Health wants to know ideas and solutions to help the NHS become better. And I'm part of my job. I do some national work for the Royal College of Paediatrics and Child Health, and we're trying to make sure that as many people, including young people, and particularly adults who work with young people, to make sure that they have written something in there. So that's my ask for all of us. And particularly if you're passionate about the environment and you can see and experience and understand the link between nature and health, then put something of your work and your wish to say, how do we join up better with organisations like our farms from John, or organisations like Northumbria, the wildlife trusts around the country actually, and the charitable sectors who are interested in this. How do we actually make sure that those links are sustained and not just dependent on an enthusiastic small group? So put your ideas in, and the more that go in, the better. I haven't got a clue how they're going to analyse it, because they're going to have hundreds of thousands of submissions. But I do want children's health and well-being to be strongly represented there. So with that, I want to thank Liz and Emma, but invite you for any last thoughts or comments before we close this huddle. Who wants to go first? Liz, do you want to anything?
Yeah, I think just final thoughts. It's lovely to hear what everyone else is doing, and I think creating this space for specific conversations around nature and health and young people is really important. And I've put my email in the chat if anyone wants to chat further or connect or has got ideas to collaborate. Always keen to do that. So yeah, feel free to get in touch. And yeah, thank you everyone for joining. It's lovely to see actually that there's so many people really interested and engaged in that topic. I think that gives me a lot of hope actually for the future. You know, often I think we're all working in our own individual things, but actually there's loads of people doing the work, and that is what can help that culture shift, is if we're all connecting and signposting and sharing and keeping the conversation going. So thank you everyone.
Thank you. And Emma?
Yeah, just going to add to that. I think thank you so much for having us, and it's such a rich sort of discussion that we've had with different backgrounds and expertise. I think one thing is like utilising these sorts of networks, isn't it, to make connections, partnerships going forwards. The other thing I just wrote down is keeping going, and there often are lots of challenges, but lots of ways to navigate around these, you know, like our examples about infection control and different levels of partnership working. The only other thing I'd just like us all to do, if possible, is just to sort of acknowledge and thank Gracie's input, because I think she had a lot of courage and really contributed fantastically to the presentation. So I just wanted to, yeah, give a little thumbs up to Gracie.
Thank you. And please thank Grace for us if you're seeing her. That would be, we appreciate the time, and hope she's the beginning of something for her as well. So good luck to her. And also very impressed, I must say, bringing young people into presenting your work and the poster thing. I think that's great. I think that's something that almost, you know, we should be doing routinely when we're sharing our work. So thank you for doing that. And with that, and I'll say cheerio to everyone. I hope it's been interesting. Stay connected, keep the work going, and yes, enjoy the rest of the week. And I hope you all spend a tiny bit of that week in nature. Take care, everyone.
Thank you.